Welcome to Physio Developers. Today my topic is anatomy of scalp. ఈ టాపిక్ని 10 minutes ఇప్పుడు ఈజీగా నేర్చుకున్నాం. Coming to the contents of the scalp, there are 5 contents. First one is layers of scalp. Second one is blood supply of scalp. Third one is lymphatic drainage of scalp. And fourth one is nerve supply of scalp. And fifth one is clinical anatomy. Coming to the layers of scalp, there are 5 layers. Scalp is made up of 5 layers. To remember these 5 layers, there is a simple mnemonic called scalp spelling. Here, S stands for skin, C stands for connective tissue, and A stands for aponeurosis, and L stands for loose areolar tissue, and P stands for pericranium. These are the 5 layers present in the scalp. This is the diagram. Must and should we have to draw in exam. This is the first layer, skin with hair. And this is the second layer called superficial fascia with blood vessels, also called as connective tissue. This is the third layer called epicranial aponeurosis. And this is the fourth layer called loose connective tissue. And this is the fifth layer called pericranium. This is the dural venous sinuses. These are the emissary veins. These emissary veins has a important clinical anatomy. Coming to the layers of scalp, first layer is skin. Skin is the outermost layer, contains hair and have the rich blood supply and contains a large number of sebaceous glands. In this layer only sebaceous cysts also form. And second layer is connective tissue. This connective tissue also called as superficial fascia. And third layer is aponeurosis. This aponeurosis also called as a deep fascia, which is freely movable on periperineum along with skin and fascia. These first 3 layers, skin, connective tissue and aponeurosis, these 3 layers collectively called as surgical layers of scalp. Coming to the fourth layer, it is the loose areolar tissue which extends anteriorly into the eyelids and posteriorly into the highest superior nuchal lines. Our skull has a nuchal lines. In that highest superior nuchal line, the loose areolar tissue is extended posteriorly. Coming to the fifth layer called pericranium. This layer attaches to the surface of bones loosely and firmly attaches to the sutures which is present in scalp. This is all about the layers of scalp. Coming to the blood supply of scalp, scalp has a rich blood supply. We also know that this blood supply is derived from the internal carotid artery and external carotid artery. These both arteries gives blood supply to the scalp. This blood supply is again divided into front of the auricle and back of the auricle. In front of the auricle, supplied by 3 branches called as a supratrochlear branch, supraorbital branch, superficial temporal artery. The mnemonic is triple S: supratrochlear, supraorbital, superficial temporal arteries. These 3 branches supplies in front of the auricle of scalp. And coming to the back of the auricle, supplied by 2 branches. One is posterior auricular branch, another one is occipital artery. In this diagram, we see clearly this is the auricle. In front of the auricle, 3 branches: supratrochlear artery, supraorbital artery, and superficial temporal artery. These 3 branches present in front of the auricle. And back of the auricle, there are 2 branches. One is posterior auricular artery and occipital artery. These 2 branches present back of the auricle. This is all about blood supply of scalp. Coming to the lymphatic drainage of scalp, there are 2 lymph nodes, parotid lymph nodes, which drains the anterior part of the scalp. Total anterior part of the scalp is drained to the parotid lymph nodes. And posterior part of the scalp drained to the mastoid and occipital lymph nodes. These are the two lymph nodes which drains the entire scalp. Coming to the nerve supply. Scalp is supplied by 10 nerves on each side. This means right side 10 nerves and left side 10 nerves. Again, these 10 nerves divided into in front of the auricle and behind the auricle. In front of the auricle, there are five branches. Behind the auricle, there are 5 branches. In that, 4 sensory branches, 1 motor branch. In this diagram, you see that branches. These branches, supratrochlear branch. This branch is supraorbital branch. This is zygomatic-temporal, and this one is auriculo-temporal. These 4 branches are present in front of the auricle. And behind the auricle, lesser occipital, greater occipital, and third occipital. These are the sensory branches which present behind the auricle. In this side, you can see clearly the auricle 5 branches, behind the auricle 5 branches. Among that, 4 sensory, 1 motor. 4 sensory, 1 motor. Front of the auricle, sensory branches are supratrochlear branch, supraorbital branch, zygomatico-temporal branch, and auriculo-temporal branch. These are the 4 sensory fibers. Motor fiber is temporal branch of facial nerve. These are the 5 branches present in front of the auricle. Behind the auricle, sensory fibers are great division of posterior auricular nerve, and these 3 are easy to remember, like lesser occipital nerve, greater occipital nerve, and third occipital nerve. These 3 is very easy to remember. And coming to the motor branch is posterior auricular branch of facial nerve. This is the motor branch which is present behind the auricle. And the last content is clinical anatomy of scalp. What is the clinical anatomy of scalp is? There are 2 clinical anatomies mentioned here. One is sebaceous cyst, another one is dangerous area of scalp. Sebaceous cyst. There are numerous sebaceous glands in the scalp, so it is the commonest site of cyst formation, which is known as sebaceous cysts. These sebaceous cysts form in uppermost layer called skin. This is the one of the clinical anatomy of scalp. Coming to the second clinical anatomy, dangerous area of scalp. Loose areolar tissue, which is the 4th layer of scalp, is known as dangerous area of scalp, and blood and pus tends to collect in this area. Blood and pus of about the 3 layers like superficial fascia, deep fascia, and skin drain to this layer, and this infection may travel along the emissary veins into the intracranial dural venous sinuses. Intracranial dural venous sinuses infection may carry by these emissary veins, which I mentioned in previous slide. Emissary veins has the greatest importance in clinical anatomy, and this infection leads to thrombosis, and this thrombosis leads to death.